those who arrived just in time can catch up, I'm sure. So thank you so many of you for joining us this afternoon for what promises to be a really interesting and important discussion on student mental health and what policymakers can do about it. My name is Vivek Bhattacharya. I am interim director of the Social Market Foundation think tank. This is an area we've been tracking with some interest as part of our broader work around education and tertiary education, along with our partners at Unite Students. So I'll start with a bit of housekeeping. For those of you who are on Twitter or X or whatever we're calling it these days, our Twitter handle is @SMFtank, Unite is @Unite_student, and the hashtag is #LAB23. You will notice the camera in the corner that is broadcasting live to the internet. Is it broadcasting live to the internet? It is broadcasting live to the internet. So hello people of the internet, and do be aware that whatever you say will live on in infamy on YouTube forever. So exercise due caution and discretion in what you say. We're not expecting any fire alarms. If there is a fire alarm, follow that green guy there. He looks like he knows what to do. Yeah, and in terms of the format of the session, we'll have a welcome from Richard from Unite. We'll pass to Rosie, Vivian, and then Matt, and then open up for Q&A. I won't detain you too long because there's so many of you. I'm sure you'll have better questions than I do. So really pleased to welcome you to a kind of perennially topical subject, student mental health. Just last week, we had a paper in The Lancet funded by Department for Education, which found that university students are somewhat higher to suffer poor mental health than, somewhat more likely to suffer poor mental health than peers of similar age. Although that disadvantage seems to be erased by the age of 25. Ongoing kind of high-profile issues around harm befalling people struggling from poor mental health, and scrutiny on the sector about what it is doing to address these problems. So really pleased to have a diverse set of contributors to discuss what policymakers, what institutions, what can be done about this, about addressing the challenges of student mental health and the broader mental health crisis among young people. So I'm going to start by handing over to Richard Smith, Chief Executive of Unite Students and our benevolent sponsor for today, to discuss what Unite are doing and why they're interested in this topic.
Great, thank you very much. Sorry. Thank you very much, Avik, and thank you everyone for coming along. As Avik has said, I'm the Chief Executive of Unite, and for those of you that don't know, Unite Students is the largest provider of student accommodation in the UK. We provide homes to around 70,000 students right across the UK. And so, while we're delighted to obviously sponsor today's Fringe event, I think we can also hopefully sort of contribute, as we have living with us at any one time, that number of students going through all the range of excitement, emotions, mental health concerns, the ups and downs that really epitomizes that transition from home, whatever home was, to your new university life. And I don't need to tell you all that university can be a hugely exciting and genuinely transformative experience for many young people. However, it can be sort of one of the most challenging times, and we sort of see that firsthand every day, day in, day out. We, as I say, are open sort of 24/7. Obviously, we provide those homes. During the pandemic, we were open throughout the pandemic, supporting the students that lived with us. And students do face real pressures. Being an 18-year-old these days is probably not the easiest time to be an 18-year-old. Huge sort of academic pressure, real financial pressures compounded by the cost of living crisis. And also increasingly something that we're quite focused on, the potential for social isolation in a world where we're all more and more connected. Actually, that opportunity for isolation is really real. So as a student accommodation business, we really want to try and do the best we can for the students that live with us. We regularly run surveys through for both prospective students and current students. And the reason that we do that is really to try and understand what's going on, what students' hopes are, what they want and expect from their accommodation, and then we can change our product and service offering to meet that. So I'd like to just share with you very briefly some of the findings from our most recent applicant survey. That's a survey that we do every year, asking around 2,000 students, as I say, what do they want from their new university life. And this year, starting with a positive, just under a fifth of students did volunteer that they had a mental health condition. That is actually level with the most recent survey from the prior year. It's the first time we haven't seen an increase. So it's a positive, but it's also clearly a very significant proportion of students. And just over half, 56% of those students who went to university did disclose, but about another quarter said that they didn't disclose. They weren't planning to disclose that they do have a mental health concern. And there's a number of reasons for not wanting to disclose that concern. One, they don't think that if they do disclose, it will make any difference at all. They don't believe there will be support available to them. Sadly, some of them think it will impact their chances of getting a place at universities, and many don't want to disclose because they don't want their family or parents to know they might have a particular issue. And it's much more likely that a student from the LGBT plus community also won't disclose that they've got an issue. And as I mentioned, sort of loneliness is a real issue, with around a quarter of students suggesting a sense of worry around loneliness, and when they actually get to university, really they believe that loneliness, 47% believe that loneliness will start to negatively impact their mental health. Perhaps the most concerning trend that we've seen in the most recent applicant survey is something we haven't seen before, and coming off the back of COVID, is the level of school absenteeism. Students saying they've regularly missed school. About 30% of students saying that they've missed time at school before coming to university. That rises to 35% for female students, 45% for LGBT plus students, and 56% for trans students. And for care leaver and estranged students, a group that we support through our foundation, that raises to 64% who miss school and also potentially have a mental health condition. So understanding that period of transition, understanding the concerns that students have, understanding how we can sort of help and support students in that transition from home, from school to university, is something that we really want to understand more, because there is no way that they can have a great experience living with us, and students spend an awful long time in their accommodation at the university, if they don't feel as though they're at home, if they don't feel as though they belong, and if they don't feel as though they're connected to their community. So what are Unite doing about it? Well, firstly, we do research. That research informs our operating processes, our practices, the product. We're constantly changing and innovating our product, but it's broadly broken down into three areas: research, things that I've just talked to, raising awareness, and then working in partnership. And just very briefly, one of the things that we're trying to understand through research, as I say, is what's happening with neurodivergent students. Increasingly, students are coming to university with real clear neurodivergent needs. We found around 13% of students self-identified to us in the survey that they either had ADHD or autism. They're complex issues, and they're issues that, if they're combined quite often with a mental health condition, means that the student can fall between the gap from the support that we're able to provide, the support perhaps the university is able to provide, or support actually the NHS is able to provide. And then I've mentioned loneliness. We've recently done some further research looking at loneliness, as have HEPI, the Higher Education Policy Institute, and it's very clear that loneliness is a really significant issue for all students, but particularly for Black students and for trans students. They do feel isolated when they go to university, and they do feel isolated, quite frankly, when they come into our accommodation. So we recently did a piece of research called Living Black, which was really a call to the sector as to what can be done more to support Black students who go to university. We're also looking to raise awareness. I fundamentally believe that if we help prepare students for the reality of the world in which they're going to grow up in, not some kind of sort of old-fashioned view of it, students are incredibly resilient. Young people are incredibly resilient. But resilience is a muscle, and unless you get to exercise that muscle and understand what you're facing and be prepared, then you may well not do as well as you can. So we have a program called the Leap Skills Program, endorsed by the Department for Education, where we go into schools and try and help students make better choices and have a better understanding of what that transition is like. And then thirdly, partnership. We're an organisation that fundamentally believes that students should have the best opportunity when they come and live with us, but we can't solve this alone. So working in partnerships with organisations such as Student Mind, organisations like Black Bullion, Future Learn, we've got a range of partnerships. We want more. We want to work and play our part in addressing the issues that we're going to talk about today. I can confirm that Unite Students will continue to do what we can to help, but we're really looking for others to help us to ensure students have the best possible experience.
Brilliant. Thanks, Richard. Now I'm going to pass over to someone who lives and breathes this stuff, Rosie Tresler, CEO of Student Minds, the UK's student mental health charity.
Thank you. Thanks, Avi. Thanks, Richard, for hosting us as well. 15 years ago, a group of students with experience of mental health difficulties got together to campaign for mental health to be more of a priority at their university. Those ideas grew into Student Minds. And since those students made time to listen to each other, we've worked with thousands more students, staff, members of the higher education community, students' unions, accommodation providers, and beyond to improve the well-being of the university community. So before I share what policymakers can do to help, we should acknowledge a bit more about the scale of these issues. We know that mental health in the UK is getting worse, and rates of mental health difficulties are increasing. And already overstretched services are struggling to meet rising demand. Thinking about students specifically, we have around 2.8 million higher education students in the UK, and between a third and a quarter of those will experience difficulties with their mental health. Higher education students will be our future teachers, social workers, doctors, climate scientists, lawyers, nurses, engineers, and more. And getting it right for this population has a really positive ripple effect across the whole of the UK. Now, there are three ways you might think about trying to influence these issues. So working at an individual level, an institution level, and then the wider UK systems. But straight away, I want to say that I believe the first two are already progressing quite well. So at an individual level, work to equip people with tools to manage their mental health is well covered by universities, charities, even accommodation providers and other types of organisations. There is a wealth of training and digital resources out there, and mental health literacy is improving, but this only takes us so far. At an institution level then, there has also been substantial progress. Over the last 7 years, we've worked with students and university professionals to develop quality standards for universities called the University Mental Health Charter. The Charter sets out all that should be done within an institution to create thriving communities, from how you teach, to the accommodation you provide, the support you offer, to the ways in which the leaders and the community actually work together. Now, the Charter is not just a set of evidence-informed principles, we love that. It is also coming with a programme that ensures there's peer support between institutions to share the challenges they're experiencing, their learning. That is what is needed to really create deep culture change in an institution. And we also assess universities when they're ready to go for the award. Already, over 96 universities are taking part, and I now feel I can genuinely look a student, an MP, or a parent in the eye and say that things are getting better. Of course, we would like to see any future government continue to monitor and support this progress. The current government has provided ministerial backing, hosted a dedicated task force on this issue, and we have over the years had investment via the Office for Students into universities and organisations like ours to support innovation. I do worry that if the university sector is not stable financially and supported to keep progressing this work, we would see a rollback on some of those really hard fought progress. Given all this progress, however, I would also encourage all political parties to focus on where you can have the most impact, and that's about tackling those bigger systemic issues. We'll be publishing our own student-led manifesto in the coming months, but also, along with 30 other mental health organisations, we've contributed to a plan to build a mentally healthier nation. The Mentally Healthier Nation report, got my prop here, which is available on the Centre for Mental Health's website, sets out concrete policies we want to see adopted as part of a 10-year cross-government mental health strategy. The plan focuses on 3 key areas: prevention, equality, and support. So it covers what's needed across the whole of the life course. And just with my final minute, I want to relate it back to students and universities. So what does prevention look like with this population? We know that by effectively addressing social determinants like financial instability and environmental factors, more of us can have better mental health. During COVID, students lost much needed part-time jobs and many had housing and money issues. But cost of living has been a challenge for students for years. Maintenance funding in England has not increased in line above inflation for the last 9 years. And on top of this, the threshold for family household income to achieve the maximum entitlement has also not risen in line with inflation, meaning students' families have to earn less to access the same support as before, and the support is now worth less. Data from ONS shows that students are working, that most students are working alongside their studies, and that affects their ability to attend their lectures and make the most of the opportunity. I spoke with a parent recently whose daughter is working until 4 o'clock in the morning to fund her accommodation and her living costs. This is not conducive to learning or building friends. She's really lonely and she can't afford the train to get back home. We're really pleased that the APPG for Students has made recommendations to government about increasing hardship funding, looking at maintenance loans, but fresh eyes are clearly needed in all parties on student fees and infrastructure development. Students are feeling the pain of a private rentals market that's out of control and ineffective public transport too. Another part of tackling prevention for this population is about tackling the climate emergency. Climate change will cause direct damage to health services and supply chains, and mental health professionals that we work with are seeing climate-related anxiety issues more and more in the therapy room. We've actually got some research coming out on this next week with HEPI and funded by the UPP Foundation, so do look out for that. Briefly, the second theme of equality, we know that discrimination and disadvantage means that risks to mental health are much higher in some groups, such as racialised communities. Building a mentally healthy nation requires concerted action to tackle those inequalities and close the health gaps. There are examples of models where you can do this work well, but we need to see this across all parts of the system. And the third and final theme is about wider support. I'm sure we all agree that you want people to get access to timely support when they need it, but by properly resourcing services, we can improve people's mental health and life outcomes. Universities provide support to help people through education, but they are not the NHS. We need great provision for 16 to 25-year-olds in the health system. We knew a student who was on track to be an NHS health worker. She'd experienced depression. She should have been offered community mental health support. She was swiftly given a quick prescription. Devastatingly, she died by suicide a few weeks later. Even with all the upstream preventative work that we'd really advocate to be done, people still need to have access to good quality care when they are ill. That's almost it from me for now. I guess my challenge to political parties is to be bold. Students are at the junction of the biggest systemic challenges of our society and have huge stakes in what happens next. So hopefully we can keep improving things together.
Great. Thank you, Rosie. And next I'd like to invite Vivian Stern, Chief Executive of Universities UK, to give the institutional perspective.
Great, well, thanks very much indeed. And I'm going to pick up on a number of things that Rosie said about the kind of context in which we find ourselves. I mean, it's absolutely clear that the needs of students moving through the university system in relation to support for their mental health are growing, and I don't see that as a trajectory which we are likely to see alter, unless it is to increase the pressure on the support that is available. And there might be a number of reasons why that's the case. I think it's clear that students who have been affected by periods of studying from home during the pandemic, moving into universities, are less well prepared for the transition, which Richard described, and need more support in order to succeed. And I think that is likely to be something that we continue to see as students move through the system. I don't think that is necessarily going to be a couple of year blip and then we'll return to resilient students. When you look further down the education system, you can see students at the very earliest years of primary school who are arriving unprepared for that first transition. So we need to prepare for what is likely to be growing pressure on this front. There are some particular circumstances. I think Rosie's right to mention things like accommodation and the pressures of cost of living on students. And I think Rosie's also right to mention the need to address the support which students have, financial support which students have access to while they are studying, as an issue which I think all political parties ought to be paying attention to. And then the final thing, again mentioned by Richard too, is this sort of issue around isolation. One of the things that rather disturbs me, I spend a lot of time I'm in the university at least once a week, and I always ask about how universities are adapting to the changing needs of students in relation to mental health. It's really clear to me. I've never been to an institution where I couldn't see that universities were trying very hard to make available the support that their students needed. There's nothing more devastating in a university community than the circumstances in which a student takes their own life, and the extensive measures which have been taken by universities right across the country to try to ensure that it never gets to that point. I think they need to be sustained. But the one of the things that rather troubles me is that if you think about how a student might enter the university community, form the kind of friendships and the support network that they will need while they're studying, that perhaps they might have had access to in their school setting, or if they've moved away from home, they might have had access to where they lived. When you move into a university setting, you've got to kind of recreate that. And one of the ways that you do that, obviously, you're going to hopefully make those you're going to develop those support networks through the people that you're studying with, but the social activities are really important. If students are taking on high levels of paid work in order to fund the costs of living and accommodation, they are perhaps less able to engage in the social activities, which really, are quite important in forging that supportive community. And it seems to me particularly the case at institutions which are serving students who might be commuter students, who might be on campus for less of the time, maybe less financially able to take up the opportunities offered by clubs and societies. That sense that we've got a bit of a problem in maintaining the sort of the level of social interaction which provided soft support around the edges to students or does in many cases, but perhaps to a lesser extent than it has done in the past in some cases. What about the university sector itself? What is it doing? Now, Universities UK has been involved in trying to work with and alongside bodies like Student Minds, with institutions themselves for a very long period of time. We've produced several pieces of work, including a mentally healthy universities framework, which was first issued in 2017 and updated in 2022. We've done work with groups representing bereaved families around preventing student suicide, which have particularly focused around what universities can learn in those circumstances and how they can take steps to ensure that the lessons are passed on between one institution and another. We've also worked very closely alongside Student Minds to support the development of the Charter, and the next phase of our work is really squarely focused on supporting and encouraging the uptake of the Charter, because my understanding of it is that, you know, there are institutions who are really outstanding in providing good mental health support to students, and there's a lot that we can do by spreading good practice and increasing consistency. But to come back to a point that Rosie touched on, we're in an environment in which the need is growing and the resources that universities are likely to have in order to meet that need are not. And so I think it's very important that we think about how we can be more joined up with the health service in particular, to make sure that we make efficient use of scarce resources to meet growing need. We've done a lot of work on partnerships with the NHS. I think it's very important that the NHS long-term plan reflects the needs of this community, and that the next government thinks about how these two enormously important parts of the fabric of our society can work together to avoid effectively an expectation being placed on universities that they are just ill-equipped to meet in the medium to longer term. So I guess my final remarks would be around that, around what we need from the future. I think the reintroduction of maintenance grants would be an important, although not directly related, step. I think we need to do more as a university community to share good practice, and we need to think about how we can meet growing demand efficiently. And for me, that has to be through partnerships with the health service.
Great, thanks, Vivian. And finally, I'm going to bring in Matt Western, Shadow Minister for Higher Education, to tell us how would it all be different if he was in charge.
Well, Avik, thank you very much. Before I get to that, I mean, I just want to say a few words, really, and that is, I try really since the 2 years that I've been in this position. Of course, we've had the pandemic, but whenever I have been able to visit institutions up and down the country, I was in Glasgow on Monday last week, but those institutions I go to, every time I go somewhere, I always ask to meet with students, not just student union representatives, but also students, because I want to talk to them. I want to talk about a lot of these issues. It's really important to me. I was a councillor before in Leamington, so I would be speaking to Warwick students about some of the pressures they face. Things have just got worse over the last few years, as we clearly know. I can say that my wife has been a head of department. She's also been a senior tutor. Whilst all the things that she may mention to me are totally anonymised, I am aware of the scale and the breadth of some of the problems that students are facing through that filter. And it is immensely challenging for students for these cohorts. And of course, through the pandemic, it has only become more difficult for them because of the challenges they've faced these last few years. I do think there is some progress being made, and I would commend the work of the Learn Group. I think that they're doing some, it's really important what they're bringing to policymakers. And obviously, the work that Student Minds is doing is extremely important in this sector. Vivian's mentioned about the mentally healthy universities framework. I mean, the key thing is about these transition points, to my mind, from school, college, home to a new home, to a new setting, and the challenges that brings likewise from, say, an institution out into the world of work. I think the mental health charter, give credit to the government. I think that the work that they are now doing is encouraging. Yes, we've had 60 universities, I believe, signing up to the Charter. 5 have been awarded the Charter status. And I think the appointment of Ed Peck is actually been an enlightened choice as the government student support champion. But I do think not enough's being done. I really do not understand how we can have had a regulator called the Office for Students that really has not given enough priority to these sorts of issues amongst the student body. Because it's been quite evident that a regulator needed to be looking at best practice and what should be done across the sector. Just last week, we saw a study that was reported, or published rather, in The Lancet, that showed that young people in higher education face a higher risk of depression and anxiety compared to their peers. I think we were sort of aware of that, but it's always interesting to hear that from a journal as well regarded as The Lancet. Dr. Taylor McLeod, one of the authors of that, explained that one of the main reasons is increased financial pressures and also about achieving high results. This is perhaps nothing new, but I think it has become much more intense in recent years. So I do think governments can do a lot more. Mental health is a crisis across society, but it is exacerbated and it's extremely challenging for students in higher education and across schools as well. That's why Labour is looking to recruit thousands more mental health staff to cut waiting lists. I know from casework that we are seeing huge waiting lists and waiting times for people trying to access mental health support. There are many issues that have been discussed. I mean, we talked about accommodation, the security of tenure for young people in their accommodation, the amount of private sector rental, of course, and just the rents that we're seeing, the increase in rents that they have. So like an 8% increase, maybe a cost of living increase, which exceeds the cost of living increases for the wider population. I know this because I do studies. I actually go to the supermarket in the center of my town, and I go to an out-of-town supermarket where the students don't go. There's a 20 to 25% premium for those people shopping in the town. So the students tend to shop in those sorts of premises. So automatically, they're paying much more. So we're also seeing so many students now going into the workplace, not just one job, maybe 2 jobs, 3 jobs. And I've seen that from a Bank of England report as well. This is bringing untold anxiety onto students. So the whole area around maintenance, as Vivian was saying, in particular, I think is an extreme concern. And I do credit many institutions who stepped in where perhaps the Westminster government hasn't been doing enough for English students compared to, say, the Welsh government or to the Scottish government. And so institutions have had to step in and pay out more support through hardship funds for those students. I think the economic issues are particularly pressing. One of the things that I'd like to do is, and Wonke Chi have highlighted this, is to actually use more learning engagement data. I think there's a real opportunity for a government and for the OFS to look at this as a means of tracking and understanding where the risks are and to actually understand how we can better manage the prospects and circumstances for those young people. Hopefully I've given you a little flavour there of some of the things that Labour would want to do, but it is a real crisis. It's a crisis in wider society, but it's an intensely serious crisis, I think, in the higher education sector.
Great, thanks very much. I'm very conscious of the just sheer number of people in the room. So instead of taking up time with my questions, I'm going to throw open to yours. We'll take them in batches of 3. We do have a mic. So do you want to take the lady there?
Thank you. My name is Hannah Swersky from the Samaritans. The APPG on suicide and self-harm prevention has recently launched an inquiry looking at young people and suicide. And obviously, students are a big group there. So I just wanted to ask you, some of you have already touched on this, but what would you say is the one thing that needs to change when it comes to support for young people and suicide prevention, and what should the government be doing differently?
Great. The gentleman at the end of the row there.
Thank you. Ian Sansbury from Aylesbury CLP and also lead a mental health charity called Mind Over Mountains. Well, first of all, congratulations for running this event. It's really important. I'm struck by how few events we have at conference that relate to mental health. I find that staggering given what we're experiencing at the moment. Really welcome what Rosie and others have said about prevention. That's absolutely key. It's key for us to create more resilient human beings. That goes for society generally, particularly goes for students. I guess in that context, I'm a bit surprised not to hear a bit more about that and what that means in practice, and particularly the 5 ways to well-being and our focus on connecting people, on enabling people to be physically active, on them giving back to society. Those things that we now know that are evidence-based that lead to better mental health. And it would just be great to get the panel's perspectives on that a little bit.
Great. It'd be remiss of me not to say that if you want events on mental health, I'm sorry, the gentleman here at the front. So if you want events on mental health, we've got another one tomorrow morning on ethnic disparities in mental health. So a little plug for that.
Well, I'm glad Evik and Matt raised the Lancet paper. It's a very important study. It's the first of its kind, really, and it's very authoritative. And it does reach the conclusion that financial pressures plus pressure to succeed combined. So I taught students for 37 years before I resigned, and I've seen quite a few scenarios, some of which were mentioned, including some tragic and some near misses. The one thing I realized, and I'm putting this proposition to you as a question, is that often they were trading in the wrong currency. They were looking at how long they were commuting, or how many jobs they had, or some caring responsibilities, instead of the common currency of how much time have you actually got available to study. And by analysing that, you could reach a conclusion about how to deal with it. It's how much time have you actually got, not try to solve the problem outside, but come inside and say, well, what are you going to need to do with less time? And how can I help you? That seemed to work in many cases if they could do the analysis, if they didn't despair so much that they walked away. Sometimes I had to tell students to withdraw, not to run away, just to withdraw and regroup. And that worked in most cases. And often that isn't said, but time available should be the currency, not time lost.
Brilliant. Matt, do you want to kick us off with responses to those questions?
So interesting point from the APPG on mental health. I think one of the key things for me, I was always struck by as a counsellor, the lack of connection really between mental health trusts and the institutions, and it was almost like this was 10 years ago, 8 years ago, that the institutions were perhaps operating independently, remotely, and that there wasn't really a connection between those institutions and the trust. I think that's a really important thing that we have to do, is to make sure that all institutions are working with mental health trusts, with the health trust more generally, and primary care. One of the best practice ideas I've come across is just when students go to a university, the data, they're signed up or approached by their GP as soon as they arrive on campus. I think that's quite an important thing to happen. So I think data is important, is particularly important with that. The 5 ways to well-being, I think exercise, yes, and volunteering, great. Totally buy into that. I think just so many that I'm hearing about feel this immense pressure that they don't feel liberated or able to escape these challenges, and just do not have the time because of the financial pressures on them. And so I do think the finances, the cost, the maintenance side of it is a really important part of this equation.
Rosie?
Yeah, I think actually there's some similar threads across those questions. So I think there's a question around responding to young people at risk of suicide. I think, and I'm speaking to someone who will be a real professional in this, but we know just how complex the reasons are, and often there's a stacked number of reasons why someone decides to take their own life. So I think that's why I would say I don't think there's one thing we would say. I think it would be saying it's about that strategic whole university approach where you're considering all elements of the system, the teaching, the accommodation, the support in place. And then I just pick up the point on prevention. I mean, I think also we have to be really careful we don't get confused between health promotion and prevention. I think what I was trying to get at with those broader points about prevention is there are things like financial issues, like the climate crisis, all these things that are going to make things a lot harder in the long run. And there's only so much we can do in telling people, you know, do this volunteering, read this resource. That stuff's, I mean, we do that. We tell students to use these materials, but it only takes us so far. There are some big issues in wider society that young people are looking for us to really actually grapple with and tackle.
Vivian, and particularly interested by the gentleman's suggestion that in some cases it might be better for students to withdraw, which obviously carries financial repercussions for universities and regulatory repercussions as well, given that continuation rates and completion rates are what universities are incentivized on or judged on to a large extent.
So, I mean, the first thing, in response to the point you make, I can see some universities trying to address the world as it is, not the world that they would like as they would like it to be, and in restructuring of the way that they're organising teaching to take account of the fact that a lot of their students are, you know, working perhaps more hours than would have been ideally the case, or just struggle with the cost of coming onto campus. So one example would be De Montfort University, where they've sort of gone for short and fat modules. They're trying to do intensive teaching in a sort of block delivery to sort of essentially adapt to the characteristics of the students they've got, to help them balance the obligations that they have outside of university with being successful at university. And I think there may be other creative ways of doing it. Another university I was at recently had sort of tried to concentrate teaching in some programs on Tuesday, Wednesday, Thursdays, because they just sort of were a bit conscious that they were struggling to get students onto campus perhaps 5 days a week for a little bit here and there. And maybe there are innovative things we can do about, you know, around that. But I think you've got to try and address the root causes. And we've talked about some of the root causes. The you know, the cost of accommodation, I think, stems all the way back to the supply of housing that's available in general. It's not a university issue alone. It's a wider issue. And we've discussed the support for students while they're studying and maintenance and the maintenance support that's available. But I think there are some things that universities can do to help their students cope with the pressures. Can I just say, I met a student recently who had suspended and then resumed their studies, and it was clearly a hard thing to do. It carried quite a considerable risk, but that student was back on the horse and on course to complete. And I think that it's important that where possible, students have got good information that will support them to make the decision that's right for them. Don't feel that they have to keep at it if the best thing for them to do is stop and regroup.
Richard, thoughts on any of that?
I mean, I think in terms of, you know, prevention, one thing I'd say from our perspective is better coordination. Quite often, a university, the NHS, the family will know that a student that comes to live with us has got an issue. Unless that student is brave enough to identify that to us, my teams don't know. We've got around 2,000 people that work across our business. Around 1,500 of them are trained in sort of mental health, active listening, mental health awareness, active listening. So they can help if they know, but too often they don't know. And whether it's GDPR or data security, and obviously they're things that are incredibly important, I'm not decrying them, but if we were better lined up, with 70,000 students, and we do see some of the most serious incidents occur in our estate, and I would never want to see that again if I could do anything. So that better alignment and coordination would be one. And then I think everyone said it, I think so much of what gets talked about, so much of what we do is arguably reactive to a situation. As a society, government needs to be more proactive. If we can ensure that our young people are better prepared for the reality of the world in which they're growing up in, not some kind of Victorian view of what the modern world is now like, they're incredibly resilient young people. I've got, you know, 2 young boys myself, you know, they're pretty resilient individuals and they're able to cope with things, but we've got to prepare them better. And that's a long-term government, educational, societal, parental challenge that we all should be looking into, in my view.
More questions? The fellow here.
Hi, I'm Joshua Forrester from the charity Papyrus Prevention of Young Suicide. We were working with Universities UK to write the Suicide Safer University plans, which include intervention, prevention, intervention, and postvention. It's really successful where it's been introduced, but how do we get more universities to create a plan and actually implement it? Is there a way to make it mandatory? How do we encourage more people to take it up?
And let's go to the lady back there.
Hi, my name's Laura. I'm a university lecturer, but also a local councillor, and I'm really struck by the synergy between the problems my students are facing and the problems my constituents bring to me. And I just wonder whether we're making enough effective use of linking up those two systems and making sure students know they can take some of those really nutty, hard-edged real-life problems to their counsellors as well.
Right, and the gentleman standing up.
My name is Thomas Walsh. I'm the former Vice President of Cloud University. I'm just wondering, when we're talking about critical challenges that faces students, why isn't there any student representation on the panel?
Good question. I should take that up. I mean, I think that, so putting panels together is difficult. There's limited space already with 4 people. It's quite a squeezed conversation. I think that Rosie is probably our kind of stand-in for student representation. I don't know if that's appropriate, and I'd be interested to know how far Rosie thinks she's happy to speak on behalf of students. I mean, it's a particularly difficult problem because when you're saying one person to represent the entire student experience, we've already spoken about the huge diversity of things. So if we're doing a vox pop or a qualitative study with an N of 1, that risks being tokenistic or misleading. So I think, yes, if we had more people, if we'd comprised the panel in a different way, we may well have gone that direction. But that's my justification. Whether or not I don't know if that's adequate or acceptable. Rosie, do you want to come in either on that or on the question about signing up?
Yeah, actually, the point about engaging with councillors, I've kind of linked to it, because I think one of the most powerful things that MPs can do is if they really make a commitment to meet regularly with representatives from their students' unions in their cities, towns, regions, if it's a bit further afield, and their vice chancellors, and actually be locally really connected, and that is how they're going to be relevant. You know, for us as a charity, the only way that we are relevant is because of the generosity of students who work with us day in, day out across all of our different work. So yeah, that is something I think is a spot on point. It could be with councillors as well. I don't think that students have enough representation at the moment in local decision making, in local health boards. I know they ICSs now and all the things that have been rebranded and everything. So yeah, and yeah, I mean, I have a lot of views about co-production. Authentic co-production would be very much about students right here, right now. I think that's a brilliant suggestion actually for future events. Our most powerful work is always where we start there, but there are also those challenges of making sure you never ask somebody to be the representative voice for any one particular part of their community as well. So yeah, good observation there. Thank you.
Vivian, do you want to come in on any of the questions?
I mean, I'm just on the point about student representation. I'm not going to, I won't respond in relation to the panel, but just to say, and maybe I don't know whether it's reassuring. I know that in every university where work is happening on student mental health, it involves students, and I you know, quite often meet with student union reps. Often meet with the student union rep who's responsible for welfare, and there is an infrastructure, which means that there is a route for students to be involved in shaping the approaches that the institution takes. Now, whether it's great, perfect everywhere, I doubt it. I mean, it's a big old system, and I imagine some universities do it really well. It's great in some parts, perhaps it could be better in others. And it connects with the point about the kind of how do you take what is great and spread it. I think that the role that an organisation like ours perhaps can play is by trying to support expert bodies and share the experience. And Papyrus has been an extremely important partner for Universities UK, because we're not, I'm going to say domain experts, which makes it sound a bit sort of wonky, but we're not the experts in this. We have a little bit of knowledge and expertise, but we really will be powerful if we work with those who have expertise and then help to provide a platform for universities to learn one from the other. Now, my view, and we've taken this approach, I'm happy to be sort of challenged on it, is that the way that we're going to do this is by supporting the uptake of the charter. And it perhaps, in itself will be something that evolves over time, but that if we try to spread ourselves too thin, we won't make much progress, especially in an era where, you just have to be careful how much pressure you're putting on institutions too. So that's the way that we've chosen to focus our energy, and I hope that will be productive.
Matt, thoughts?
Sure. It's interesting to hear what Vivian says, and I think that's probably the right route. Just on the wider points, I do think there is it's incumbent really on representatives, councillors, MPs, to reach out to the student community. They can be significant. But irrespective, they are a part of the community, and it's really important. I as a councillor, used to do that actually. I was known as the Labour man. They didn't really remember my name, but they remember they remember seeing me. And so ahead of the 2017 election, I was known as the Labour man, because I did work. I did specific stuff for that community, and they really valued that. So I do think councillors really should reach out. And to support them, whether it be doing surgeries or casework or whatever. There are so many issues. I mean, just talking about mental health, but whether it be the housing conditions, mold issues, whatever, rent deposits not being returned, there's a plethora of issues that the community faces, and it's really important, I think, that all representatives should do that. And I do think the point about those representatives meeting with student unions, the welfare officers, so I did that last year, I haven't yet met with the new ones that started in August, is also important, so that the representatives know what the priorities are from them and vice versa.
Richard?
Nothing really, there's particularly more to add, other than obviously as an organisation we have students living with us, we regularly ask them the applicant survey, the Living Black survey, all based on student feedback. But then the only other thing to say is I'm aware of the work of Papyrus. Please feel free to reach out. We've got 70,000 students. Whether your framework is applicable to an accommodation environment or not, I don't know, but very happy to have a conversation.
Great. I think we should be fine for another batch of questions. So the lady in the middle of the row there.
Hi, I'm Sophia. I'm from the Labour Campaign for Mental Health. So I've seen a lot of discussion on prevention, and sorry if I came a bit later, so I might have missed something. But I was just wondering how are you responding to more complex mental health conditions? So eating disorders, for example, there's a lot of policies that are incredibly ableist. And as someone with both mental health conditions and disabilities, my experience at university was they just did not know how to support me because of the complexities. So I was wondering how you're working on those kind of plans. And as a kind of an extra question to that, what are you looking at in the way of safety plans? Because when students leave university, they're basically left with nothing. And that's what happened to me when I left university. I had a full mental health plan, a system, a CPN, and a psychiatrist and a psychologist. And I left and I couldn't get anything for a year. So I'm just wondering, how are you looking at those safety plans? So it's important prevention, of course, but I think there's also other elements to look at. Thank you.
Great. Lady here.
Hi, I'm Sophie Ing. I'm a journalist at Research Fortnight. I just wondered if the panel could comment a bit more on the role that the Office for Students could play in this. Matt Weston, you mentioned a few things about that. Thanks.
I'm glad to hear at the front.
Hello, thank you. I'm Alison Johns. I'm Chief Executive of Advance HE, sector development agency. We're largely focused on staff, and I think it's important not to forget the staff who are actually there to support the students. We work very closely with Vivian and the team, and with Rosie. And so the kind of things that we do, we produce guidelines and frameworks. We work with Edward Peck, the Higher Education Student Support Champion, which is looking to produce those frameworks and looking at service redesign as well, because if you don't change the system, we can talk about a lot of things, but we need to think about how we support institutions to change their systems internally. And so really it's just a plea not to forget the staff who are very important in delivering the services in a way which doesn't really overwhelm and overpower them. I think the point you were making, Rosie. Thank you.
Great. Should we start with Vivian on what happens post-university, the OFS, if you want to talk
I'm going to
about
say something massive. I think it's going to be a bit controversial. I think the OFS. I think the OFS should focus on quality and access. I don't think the regulator should be deployed to address everything that whatever. I'm sorry. This will not apply. Should Labour win the next election? But whatever this week's minister thinks, please don't quote this. I'll get in such trouble. But I think, oh God, I shouldn't be allowed to sit on a panel. I think that the idea that you can regulate in this area fills me with a little bit of horror. I know how hard universities are working to try to support both staff and student mental health. It's really, really difficult. They're not healthcare settings. I mean, the lady who mentioned the often quite complex and intersecting needs of students. Universities are not healthcare settings, though it doesn't mean they don't have a responsibility. It doesn't mean they shouldn't bust a gut to look after their communities. But at a certain point, you have to acknowledge that there are limits to what a university can do. And, the idea that we, with a regulator that I think is a very, very important development in our sector. I think it's right that we should have, a regulator that is there to ensure that universities are held to account for the quality of the experience that students are getting, and that it's also designed to ensure that universities are open to all of those who have the potential to benefit. I think when it gets stuck into other things at the behest often of ministers, you start creating a kind of labyrinthine bureaucracy, which does nobody any favours. And I don't think our current minister is quite happy to say there is no more money. University, the resource available to support undergraduate education in England has been stuck for a decade. And our current minister will say, we don't have any money, and if we did, we wouldn't give it to you. So my plea, both to our current government and to Matt, is if you can't help us, at least stop making it worse. Make sure that the scarce resources that are available to support students go into supporting students, not to satisfying an increasingly burdensome regulatory mechanism. Please do not quote any of the above, despite the fact that you're in fact a journalist, and I should have started talking. I think I should probably shut up.
It's a good question. I'd like to know what you think, Matt, because it was my instinct as well, to be honest, when you brought in the OFS to say this is a regulator that has been criticised for being overly busy and stretched across a rather sprawling portfolio of issues rather than focusing on its core business. Is this core to what the OFS should be doing?
No. No, it's not. I didn't mean it to be core. But I do think if you start straying, I'm just saying it's the Office for Students. What is the purpose of this body? If it is an office for students, then it should actually have the concerns of students at heart. Now, I'm not saying, and I think Vivian's absolutely right to pick me up on it, because it's not a kind of really central plank of what the OFS should be. Far from it. But I do think that it really, for me, with the freedom of speech, to my mind, this did not need to be an OFS issue. However, I do think there is practice that needs to be in place that should be followed by institutions, and for them to adhere within certain tramlines. And I guess what I'm saying with mental health is that I would expect that all institutions have a good practice in terms of the approach to mental health, sexual harassment, and assault on campus, that there are these practices. I'm not saying that it should necessarily not be within OFS, but I would like to believe that all institutions will have protocols in place. Now, who actually ensures they are in place, I'm not sure. I'm not necessarily saying it should be the OFS, but we must make sure that there are no gaps, that this is not a risk. It's not just down to, oh, well, you happen to be at the wrong institution, they didn't have a protocol in place. We do need to make sure these things happen. So Vivian's right, it's not really for a regulator to be doing that, but we do need to ensure that institutions are doing the right thing. And just perhaps on Alison's point, I do think, going back to the practice, we need to make sure that it's not just the student-facing staff, and I'm talking about the academic staff here, or lab technicians, whatever it may be. I'm talking about all staff, that people need training, that there needs to be a cross-campus approach to dealing with the sorts of issues that I've just dealt with, not just mental health, but others as well, that they look out and they're aware of, or people approach them because they might be seen as a safe individual that a student can talk to. So this is really far-reaching stuff. We haven't thought through kind of how this should be, when I say managed, I mean managed. I mean how this should be introduced, overseen, scrutinized, whatever. But certainly the OFS, I think, has been running down all sorts of rabbit holes, and there are certain more important things that it could be doing.
Rosie, feel free to give us your views of the OFS, but there's a couple of other questions in there as well about complex disorders, how they interact with disabilities and post-university plans.
I guess I've tried to set out why we think a quality improvement approach is needed, why we think that will be more sustainable, especially after what the sector and all of society has dealt with in recent years, but also how that creates a culture of openness and transparency and learning. So so you can see where I land on some of the stuff that's been mentioned, but I would say that there were really important major funding programs that came through the OFS in the last sort of 8 years or so, in which universities were able to bid collaboratively for funding to do something innovative in specific areas of mental health that maybe hadn't had attention before. So particular diagnoses, for example, or particular communities of students who've been neglected historically. So I think the idea that any of these organisations, we have to be really careful what we wish for, people not being involved actually as well, is there is a need to keep supporting EDI initiatives across the whole of the sector. I'll leave it there because there's too much. Really good questions.
Richard, I'll give you the last word since we're almost at time. Do you want to pick up the OFS or not?
I think I didn't entirely agree. The clue is in the name, and that's where the focus should be. I'd probably pick up the point around sort of complex needs, and then the support that's needed sort of post-university. It's something that we as an organisation are starting to think about. We've got a terrible term, post-university preparedness, but it is another key transition point. You're at home, whatever that was, transition to university, you face all those challenges, you then transition into the world of work or the world beyond university. The support at that point, even if we're being critical and analysing the support that's available within higher education now, the support that's available at that point is often very poor, unless you're very lucky with the employer that you go to or whatever it might be. That's where there needs to be that joined-up approach, ensuring that people are supported right through those key transition points.
Fantastic. Great. Well, jam-packed conversation, jam-packed discussion, lots of issues to pick up. So all that is left for me to say is thanks so much to the panel for their insights and contributions. Thanks to Unite for their support and partnership. Thanks to you for being a great and engaged audience, and enjoy the rest of your conference. Thank you.